our Healthy Living segment this week, we have a different, slightly different looking Dr. Holly, right? Because you're not Dr. Holly. We have a new Dr. Anwar of the Southeast Texas Medical Associates, though you do work there at SETMA, so of course also very qualified. But today, Doctor, we're talking about the Eye Care Project. Can you tell us exactly what that is?
Sure. First of all, thank you for inviting me over here. I'll try to do justice to Dr. Holly.
I think you can be fine.
The Eye Care Initiative, actually, Dr. Mark Wilson, who was one of the founding partners of SETMA, started geriatric practice a number of years ago. We brought in the Eye Care Project, which is basically modernizing it, putting modern techniques and modern technology to geriatric care. As you know, the geriatric population is what is increasing. The Eye Care actually stands for Initiative for Comprehensive Advanced Healthcare Resources for the Elderly. Okay. It's a long name, but primarily patients are in nursing home facilities and so forth, which is trying to get the modern aspect to it.
So bringing it in more modern, that is actually, I guess, providing a better quality for them in the healthcare, and maybe is it easier for them to be able to understand it too with the modern technology, them and their families, kind of bringing it together for them?
Absolutely. Actually, we have three main goals. Our patients, geriatric or otherwise, especially the geriatric population that needs most of our care, we want to get the state-of-the-art technology along with the compassion part of it. Okay. So basically, and that's one of the areas that we have, which are Achilles' heel. Not a lot of doctors go to nursing homes, and a lot of doctors don't want to spend that much time in there. But what we did, we brought state-of-the-art electronic medical records, where the continuity of care from the hospital to the outpatient clinic to home health to hospice to nursing homes, everything's on the same database. So I can be sitting in France and click a button and find out what's going on with what patient where. So that, and what that does, since we are a multi-specialty clinic, we have infectious disease, diabetic specialist, everything, I can just click a button and say, look, can you help me out here? And suddenly we are talking at the speed of information, which has never been done in Southeast Texas before, and we were the first one to bring it.
Wow, and with that being so important to healthcare, and I imagine that's so important to you and the rest of the doctors at SETMA, because it's helping provide the better healthcare? Absolutely. I mean, frankly speaking, the olden days when we will hold a pulse and tell you what you have are long gone. This is the computer age. Computers makes us better. There's not a single person on the planet that can say they know everything or medicine has to offer. So we need computers. We need the informational technology, as well as, like say, if I order a medicine to a particular patient, the computer will tell me, look, this is a side effect here. And suddenly we can prevent all those medication problems that can occur. Wow. Now, obviously, the same patient goes to the hospital, the same information is available, so there's less chances of redundancy as well as mistakes. So any sort of error can, if it's right there, you know, of course there's so many different patients I know that the doctors deal with, so you want to make sure each patient, sure their files are in the computer, so then you just pull it right up. Absolutely, that's one of the biggest things. But there's another thing, is that one of the other goals of it is to help the nursing homes. The nursing homes is a very, very tough business. They're put in a very awkward position. They're taking care of the sickest of the sick, and their expectations is more. And our job is to be available for them too. Great. Well, we appreciate that. Of course, we know that is a tough part of being a doctor, being able to take care of, but you guys at SETMA are making sure that you stay on top of that, and we appreciate that. Thank you. We try every day. You're welcome. Thank you for being here. We'll have all the information on our website too from this interview, and of course SETMA's website as well. Thank you.